those the only two treatment. It is radio, no, that is.
So sometimes patients require radiotherapy, especially if their breast cancer is preserved, the entire breast is not removed. Then they require radiotherapy. If their lymph nodes are positive in the axilla, in the armpit, CT scans or anything like that, no. We don't recommend any PET CT scans or CT scans in the follow-up if they are treated with a curative intent. We do tell them to have a 3-monthly checkup done, a self-breast examination of the other side, and if you have undergone a breast conservation surgery, then self-breast examination on the side of the operation as well. And every 3 months a clinical examination for the first 2 years, then we gradually increase the gap to every 4 months, then every 6 months, and after 5 years is once in a year that we come for a checkup. And we generally just do a mammography of the other breast, a few very simple blood tests, and nothing more than that. And we just definitely tell you to have a very nice and happy lifestyle, to stay happy, to do some exercises and have a good body mass index, to have a healthy body weight and height ratio. We tell you to eat everything which is healthy. Yes, junk food is allowed once in a while. It's not that you have to bother yourself by eating everything which is very balanced diet. You can have cheat days, right? Cheat days is when you can have whatever you feel like eating. But yeah, the junk day, but yeah, that should be occasional. But otherwise, you should have a walk every day. Maybe you can practice some meditation and relaxation techniques, and drink 7 glasses of water every day. Eat a lot of proteins, good proteins, not the red meat, but white meat is allowed. And keep yourself happy. That's most important. And I'm sure that every person knows how to keep himself or herself happy, because that is the winning game. One of the most important things is the time when they have, the cancer cannot be treated and it does become a death sentence, but not routine. So I think it is very important to be self-aware and reach your treatment center on time, so that you are taken care of.
When is late?
So it has to be aware, being aware. Being breast aware is one thing for breast cancer, but if you have a symptom which is chronic, which is not improving, then it should be investigated in the right manner, and then the patient should be referred on a timely. If you are referred late, then perhaps, and you lose a lot of time in investigation, then the situations can become worse. So cancer is definitely not a death sentence. Breast cancer, which is one of the most common cancer, is 80% cured. If it detected early, 80 to 90% cured. And various other cancers can be cured very nicely. But you just don't have to ignore your symptoms, which you think are untoward and are not routine issues.
What do you have got to say about the support system
For the treatment of cancer?
the treatment of cancer?
That's a very important question, I think, because treatment of cancer is expensive. Yeah, and I think having a good insurance policy right from the very beginning, before even cancer touches you or thinks of touching you, I think having a good insurance policy, an international insurance policy, if health conditions are not very good in your own country, having an international health policy which reimburses your health bills even outside your own country is something which should be the most important. So I think that is the biggest insurance, biggest support system, because the cancer treatment is expensive. There's no doubt. There's nothing much that doctors can do to make it less expensive, because drugs are expensive, overall care is expensive, overall treatment is very lengthy. So having a good health insurance policy is, I think, can do the trick for anyone. So think about it, get a preemptive health insurance done. That should be the best supportive therapy for you, for anyone.
What do I have to carry? What care?
So as I told you that the care is very simple. Every 3 monthly checkup by an expert. Whether even if it is in your country, if you can make it over here once in a year, we'll be happy to see you.
Okay.
And you are left with some doses of your bispecific drug, your HER2 targeted therapy.
Okay.
it will be good if you can complete that, even if you have to complete that in your own country. It's a very simple protocol, but the drug is a cold chain drug, so you must maintain the cold chain if you buy the drug from here. And you just complete that protocol. Generally, there is no side effect of that drug. So if you just complete that protocol, then you are good.
Thank you.
Welcome. Okay. I hope that this was a nice discussion, and it throws light to those who are suffering or who have suffered from this disease, and gives you an insight that how it works out to be to get to your place of treatment in India, and how the treatment of breast cancer actually is like, and what are the steps of the treatment, the prognosis and things like that. No two breast cancer patients are the same. Definitely every patient has a different prognosis, every patient has a different outcome, but simply put, if you club them together, there are 4 subtypes, there are 4 different stages. In stage 1 breast cancer, simply put, the treatment may be only surgery and nothing else. The cost of treatment is much lesser, 1/5 of the total cost of advanced breast cancer, and the cure rate is 90%. But if you detect it in stage 3, you'll have to undergo a surgery, a chemotherapy, a radiotherapy, and sometimes even hormone therapy. The cost is increased 5 times more, and the cure rates are decreased to 50%. So detecting it early is the key. Self-breast examination is very important for every female, and I think with that we can treat many more patients, especially for resource constraints countries like Kenya, India, and henceforth. I think early detections is the key to success in as far as cancer is concerned. All the best.